Hello, this is Dr. Charlie Mastrovich, and in this video we're going to discuss what to do and what not to do in implant mechanical rescue, really based on your level of education and the technical tooling that you have available to you and knowing how to use it. So the mistake I see made is to use rotary instruments that are unguided and ultrasonic instruments that are always unguided and very difficult to control. And we'll touch on both of those in just a moment. But as you go through the learning curve, there is a means of using hand instruments. So like we expressed in the microscope video, you don't have to have a microscope to do some of the straightforward cases. And you'd be surprised how many are straightforward if you have a microscope. But if you don't have a microscope, you can still do 30, maybe 40% of cases if you're the first one involved. So along that line, I would say that the tooling you'll have available to you are the three tools I talked about earlier. It's an endodontic explorer, a modified endo spoon that we have on our, how to create that on our website. It's mastrovichdental.com, and it's easy to do in the laboratory with a diamond disc, and then a high quality mouth mirror so you can get a better light reflections. So that's where you start, and those basic tools are used in diagnosis as well. And you have to be aware that when you're not using a scope, your diagnostic skills are limited because you can't differentiate mobility on screws as well, and you might think a screw is stuck when it actually isn't. So it's a limiting factor. The danger is to get into an appointment and try to thinking, oh, I just about have this out. You know, I think if I just rotate it with a round burr running in reverse, or I'll try this or try that, or an ultrasonic unit, and it just makes matters worse. So you have to be able to diagnose, you have to be able to see things, and you have to know when to quit if you're at this level of education and tooling. Now, a couple words on guidance and a couple words on ultrasonics. I mentioned that rotary tools should not be used unguided, and that's not exactly a law, but it's close to it. There are a couple situations that we do, because we have microscope visualization, that we can do that very, very carefully, and not in all cases, and it's not appropriate probably to get involved with that at this point in time. But I would say routinely, if you're picking up a handpiece and you're trying to put a slot in a screw, all you have to do is nick a thread, the screw gets more progressively locked, and you run into more and more problems. Likewise, the internal use of an ultrasonic unit is very, very difficult to do. I have never done it inside an implant, and we've done a lot of cases, probably in excess of 800 screw retrievals successfully without it. Why? Because the mobile screws we can take out with our basic mobile techniques. Mouth mirror, endo explorer, modified endo spoon, we rotate a lot of them out. And so we're probably at the 70% level with just those tools and a microscope. So when I say that my microscope's my number one tool, it's absolutely true. And those basic tools are not only diagnostic, but they also rotate out a lot of screws, and we solve a lot of cases that way. Now, when a case seems to be stuck, I don't know how many cases are really taken out with an ultrasonic unit, because no one's referred to me when the case is successfully recovered. But I do get to see many, many cases that have been attempted recoveries and failed post ultrasonic use. And it's amazing how much damage can be done into titanium utilizing an instrument that's going back and forth like 34,000 times a second and vibrating. You can eat up titanium. It looks like you've cold welded it together. And we did one little study that you can visit on our website again, mastrovichdental.com, and it's the use of ultrasonics in dentistry, and it shows, I think, about 4 cases linked together where significant damage was done, and the cases had to be resurrected with much more advanced techniques. So my suggestion to you is, no matter where you're at on the learning curve, keep the ultrasonic units with a hygienist, and you work toward having better visualization and utilizing hand instruments. And if you can't get it out with that, you can pass the case to someone that can, that is not injured in any way or made worse in any other way, so that things don't hit off the rails, so to speak. So with that advice, I think I can just close with saying that it's better to be safe than it is to be engaging and trying super hard to get something out and find out that you've created more of a problem. And so thank you for your attending this video, and I look forward to helping you in the future, and hopefully you see the value of having this in your